So you had your consultation and you book for the surgery. Now you reach the hospital on the day of surgery. There will be admission. The nurse in the hospital will take some details, measure you up, weight, height and all the rest, so that you're fit enough for the surgery. Then the anesthetist will walk in and examine you to ensure that everything is fine. You will see the surgeon again on the same day. The surgeon will go through things with you briefly and then ask you to sign a consent form. Obviously this is all quite daunting. You're in a new place, you're meeting new people. This can make people feel completely out of place. However, I can assure you, if your surgeon and your anesthetist are there with you, they will look after you. It's their duty, it's their job, and that's what they enjoy doing too, like I do. So when you walk down to the anesthetic room, you will again meet the theatre staff, which is again maybe unfamiliar to you, but they're all very lovely people. Whichever theatres you may go into, they make you feel welcome, warm, and then you may, if you have decided to go through general anesthetic, then you may have a needle in your arm. That's where, or you can put anesthesia by a gas and mask, and then the needle can be placed afterwards if you have needle phobia. Then the surgery is undertaken, everything is ensured that there's no issues. Then you're woken up in the theatre and then taken into the recovery, ensure that you are recovered from the anesthesia, then you move back to the room. Obviously the first few hours are still groggy, you may not remember anything, you may not even remember that the surgeon has come back and seen you, and it is very common because it does happen with me. Patient says, oh, I didn't see you after surgery, but that's what surgeons do. It's their duty to go back and see the patients afterwards to ensure there is no issues. And then if you're staying overnight, you may be seen the next day, but if you're a day case, you're seen, you made sure that you've been up and about, you've been to the toilets, you'd have had something to drink, you'd have had something to eat, and then of course you're not allowed to drive, so there'll have to be somebody to come and pick you up and take you home. And the law states that you need to have an adult who can care for you for the first 24 hours. So this is what you can expect, but our aim is to ensure that all this process is as smooth and as easy as it can be for a patient. I do understand that you're terrified sometimes when you're there, but then look at the positive things that can come out that I've already alluded to earlier. The change in physical shape, the big boost to your self-confidence, and all the things that go with it.